When I was young, I used to be told about my condition and what the future looks like and different treatments that I'm going to have to do. What I wasn't told at the time was the number of antibiotic-resistant infections and sepsis that I would experience. My name is Gavin Schranz. I'm 26 years old and I'm from Malta. I work in the healthcare IT industry and I've recently completed a Master of Science in Digital Health from the University of Malta. My master's thesis focused on using digital tools to educate the public on the prudent use of antibiotics to preserve them for the years to come. My hobbies involve taking my dog out for walks, taking my dog to the cafe, or taking my dog anywhere. So I'm a renal patient. I'm currently undergoing hemodialysis and I'm in the final preparation for a nephrectomy, which are the removal of my kidneys, and for a kidney transplant from a live donor. It all started when I was born. I was born with a kidney condition, and over the years it got worse and worse, and we've had to do a number of series of operations and surgeries to mitigate and to push back as far as possible a kidney transplant. When I turned 15, I had a rather major surgery, a reconstruction, and whilst this surgery was successful, it led to a number of infections post-surgery. And I was in hospital, in and out of hospital for a couple of months with quite severe infections, and I was always taking different courses of antibiotics to tackle these infections. Unfortunately, these infections were rather severe. They led to quite harsh pain that was only treatable with doses of morphine to reduce them. These infections and these episodes post-surgery ironically led to more hospitalizations and hard times than the kidney disease itself. So the repercussions of the treatments and the surgeries to tackle the kidney disease led to infections that to me are the hardest to deal with. My latest infection actually was in my fistula that is used for my dialysis sessions. I got MRSA and I couldn't use the fistula until the MRSA had passed. So this was quite a difficult situation because I was using a neck catheter until I could use the fistula. And that was treated again with second-line antibiotics. Luckily, my mom is a doctor, so throughout this whole process and throughout my years, she's been able to help me immediately with any problem that I have, be it at home or at hospital. And we're a family of 5 kids, so it's not easy when one of your children is hospitalized and you have to stay with them and you have to care for them whilst also giving time and care to your other children. I can't imagine what it's like for my siblings and for my family to see again and again these difficulties, and at times I was so distracted and I was so oblivious to my surroundings because of morphine, painkillers and whatnot, that it was actually my family and my closest friends that used to suffer even more than me trying to do something when there is nothing to do. From all these infections and hospitalizations and difficult times, I've learned a number of key lessons over the years. Hand hygiene is super important. We interact with a lot of different people, objects, and it's important to keep our hands clean because we can not only bring infections onto us, but give infections to others. And another important lesson that I've learned is to never self-medicate, to never take antibiotics without a prescription from my doctor. It's very important that we take antibiotics only when they are prescribed to us. So what's important is that everybody realizes that AMR can affect them either now or in the future in different ways. It is not only people with medical conditions and what you do affects the community as a whole. So as I approach the removal of my kidneys and the kidney transplant, my priority for these surgeries is that if or when I do have an infection post-surgery, there will be good enough antibiotics to tackle that infection.